Anyhow, I wanted to talk about my why. This is my husband and I up at snowmass skiing a couple years ago. And then we went to a Halloween party. They did that Yellowstone theme. So it was actually a lot of fun. And that's our kids and our dog as we were heading up to go actually skin up the hill. So, okay, so we're going to review a case today. Things going on. So this client came to me. He had seen multiple other doctors, cardiologists, other actually integrative medicine doctors, and I'm not faulting, just so you know out of the gate, anything that they were doing, but I just want to show to you different things that you have to kind of think about. But he came to me because he was really having a lot of mental and physical fatigue for months, and he just said, I can't focus, and he goes, I'm out riding my bike, I can't go very long, and my wife is kicking my butt. And I have to go home, and I'm just not happy about that, and she's not happy about it either. But anyhow, one of the things that popped into his mind, he had actually had some heart issues, and they put him on a statin. And statins, sometimes you hear people talk about muscle pain and that. He was just having a lot of fatigue, so they took him off the orals and stuck him on a Repatha, which is like an injectable form that you can use. And initially he said he felt better. But then he just started having more of this fatigue, and it was one of those things that kind of crept up on him, and he wasn't sure exactly when it had gotten really bad again. And so he also said, he goes, I've done testosterone pellets, yeah, I'm overdue, I don't know if it's that, but I also was traveling with a bunch of guys, and I got COVID, and I gave it a couple months, so that was like in April, and he came to see me mid-summer, he goes, but I feel like that's gotten better. I don't know that it's really that, but there's all these things going on, I just don't know what to do. So we kind of started talking, and I think he was just frustrated. He goes, I feel like I'm looking for a needle in the haystack. I've got all these things going on, and I just don't know where to go with it. So we kind of sat down and started going through some different things. So again, we talked about being on the statins and some of the problems he was having with that. He did have an MI back around the time of COVID, and they had put him on these medications again to get his LDL down. His LDL was never high, super high to begin with. But there's been a trend in the medical industry to really cut down on LDLs for people. They used to be, they said, you know, below 100, then they got down to 70, then they were down to 50, now they're down to 30, and some people just don't tolerate this well. So anyhow, again, they put him on Repatha, and when they did that, they tried to get it down to 30. Again, like I talked about, in April, he noticed that he was having all these issues. He did have COVID. Again, just having a lot of problems with fatigue and not knowing exactly where it's coming from. So when we sat down, these are all the kind of things that we have to look at. Is it the testosterone? I don't put testosterone or people on testosterone just to help with energy. There's a lot of things that you got to think about. Is it stress? He has his own business. Is it stress related? Is he not sleeping well? Does he have long haul symptoms from COVID? I don't think so, but maybe. One of his things was, am I just getting old? Yeah. As you get older, your body changes, but that's not the reason for feeling like that. There's got to be more going on than that. And the other question of it is there something else going on with his heart again, and we just need to have it checked? But it had turned out that he had just had a nuclear stress test and echo. All of that was good. There really wasn't anything new to do there. He had some dental stuff going on. One thing I did not mention on here, he did actually have throat cancer even prior to his heart disease, and that always affects when you have radiation therapy. It will affect your dental health. Dental health can affect your heart. So all of this stuff kind of goes together. He's had hypothyroidism, nothing new there. Testosterone replacement, again, he started it 5 years ago because he wasn't as mentally sharp, didn't feel like he was gaining muscle at the gym. It was helping him. He just got behind on getting it. There really wasn't any other big issues there. And the other question that I brought up, is it his sleep? Sleep apnea can have a big effect on people in multiple different arenas. It can affect your heart. It can also affect just your brain function and everything else you're doing on a day-to-day basis. Going through his history, the other notable thing is he has this MTHFR deficiency, which is methyl tetrahydrofolate deficiency. It's an enzyme your body needs to basically folate your B12 and make it in an active form. He had this. He didn't know he had it, but he was already on supplements, so there's really nothing new there that we need to do. These are just labs that we just recently gotten, and I gave you kind of a quick comparison. His LDL, again, was down to 35. His estradiol was 71. That is not good for a guy. That in of itself will make you feel tired. So we looked at his thyroid. Thyroid was fine. This just gives you a comparison, again, where you can kind of see he had been a little bit higher, and then they kept trying to like really get his LDL down to a lower level. So the question comes down to, how do we improve his energy? So things that are obvious, his estradiol levels, we have to get those down. His cholesterol levels are really low. The question of it is, everyone would ask, do we really fix this? Yes, you do want to fix it. You need cholesterol for a lot of things, which I'm going to show you. And this is impacting him in multiple ways. It's impacting his brain function, it's impacting his hormones. And heart function, again, we looked at, there is nothing really going on there. We did, like I told you, he is on supplements for that deficiency. But the big point in this too is that cholesterol does not cause you to have heart disease. It's inflammation in your system with the cholesterol that causes heart disease. And a lot of people don't understand that because everyone talks about just take cholesterol medications. So this is why cholesterol is important, because it is kind of like the mother lode of everything else your body needs. It is all of your hormones. It is your cortisol to help you with stress. It is your testosterone, your estrogen. You need to have cholesterol. And not only that, your brain needs it. It needs it for the myelin sheath that protects the nerve roots. It needs it just for synaptic function. If you're not having synaptic function, that little connection between this nerve and that nerve in your brain, you're not functioning. So there's multiple reasons why he is really suffering. So this is what we came up with. So we stopped his Repatha, we put him on a little anastrozole. Anastrozole helps to bring down your estrogen levels. And again, we don't want men to be at a 0 level, but there is a nice range, and he was too high. We really ideally want you to be probably 15 to 20 to maybe 40 on the high side. So we started with that, and I checked in with him about 4 weeks after that. He was feeling about 60% better, not completely better. We had checked his testosterone levels. They were like 700, I think, back in May. But I thought, let's put him on the anastrozole, see where he's at. His testosterone levels are still dropping. What we typically say is when men get down to that 200 to 400 range is when we really notice that people don't feel well. Everyone's different, though. There are some people that can function on a really low testosterone level, so it's not always just that. But because it was still dropping, he was going on vacation. He goes, I still need a little oomph. We did decide to go ahead and do a testosterone pellet. When I saw him at that time, right, the day that we were doing the pellet, his estradiol level had gotten down to 14, so we were going to back off on the anastrozole, because again, I don't want him to get too low. If you get too low as a guy, you can actually increase your risk for heart disease. So you need to make sure you stay in that nice little window. There are some supplements. One of them was Choline. He'd actually been on it before, and that's a nice way to help decrease your cholesterol a little bit naturally without the side effects that you get from statins. So we're putting him back on that. He had ran out of it and just completely forgot about it. And then we're also going to put him on some supplements which help stabilize the glycocalyx. Glycocalyx is like your cell's protective wall and protective function. And sometimes that can get damaged when you either have inflammation or, again, maybe you have too little cholesterol and your body just can't make that protective barrier. So we kind of did all of that. He went on his vacation, came back. He's now feeling 80% better. So now the question of it is, what else can I do to help him? He was told a while ago, again, to get a sleep apnea test. He just had never gotten around to it. So that is now what we're going to do. The nice thing with sleep apnea tests, they're much better now. They actually have home monitors that you can use. You don't have to go sit in a hospital. I don't care what anybody says. When you go to a hospital and try to sleep, you're not sleeping the same. It's just not accurate. So they have these other ones. They're about $200. So we're going to see if there's anything going on with that. And if that's an issue, then we'll actually get them started on a sleep apnea or a CPAP machine to help with that. But this again too is looking at when people think about hormones, everyone thinks testosterone and estrogen. There's so many more facets to it. It's the cholesterol that's affecting your brain, that's affecting all these other parts of your body. And again, this is when people come in, this is my passion. I love seeing this because a lot of people just, and I get it, you just don't understand the bigger picture, but it's your thyroid, it's your estrogen, it's your cortisol, it's all those kind of things put together. Sleep can impact your cortisol, it can impact a lot of other things as well in terms of your health. But I just kind of wanted to give you the synopsis in terms of what the bigger picture is. So, does anyone have any questions at all? No?
I don't necessarily have a question, but I just wanted to share my experience just in the last week. So I am at that age of where my hormones are definitely changing. I'm fully like in menopause, and I have felt different in the last year. Like I have literally, it's been very odd for me because I have not since I've been doing my career felt the way that I felt. And so I went in to see Dr. Jill last week actually, and you know, there's just so much more than the story that you get about testosterone and estrogen, and just do the pellets. And it wasn't working for me. And so I'm really excited to see a different course of action that she's taking me on, just stuff that I didn't ever think about. And I'm in the field, and I also just love working with her patients because they come in with this massive like picture of what's actually going on with their body. So it makes coaching much more pinpointed that way. So thank you.
So, all right, well, thank you.
Why the medical profession's almost singular focus on cholesterol and fat and statins?
Well, I'll tell you my bias, and maybe Christy can tell you hers. When I went to medical school, they do not teach you business, and they do not teach you to look outside the box for the most part. They have a little realm that they work in, and you really have to start looking at all these other facets of things. I think the other thing of it is too, and I'm not saying it's all tainted, so don't take this the wrong way. Pharmaceutical companies have a big hand in what happens. And so there's that aspect of it. I'm not saying that medicines don't have a place, because they definitely do. But it's like anything else. We talk about censored information. Part of what we get is censored information. It is what it is. What do you think, Christy?
100%. I mean, cholesterol is so important for your brain. And like, same thing, the number of people we see that are feeling terrible because their cholesterol's to the ground. And there's a lot of pharmaceutical influence in, and you can look up what company has the biggest statin on the market, and it'll make a lot of sense.
Yeah.
Yeah, right?
So anyhow.
100%.
All right, well, thank you guys. Any other questions?
Thanks.